All right, Dr. Riley. Well, thank you so much for joining us today. We're really looking forward to having you at iFru. And we just have a few questions that we wanted to ask you. The first one is, what are your thoughts on the evolution of robotic surgery as it pertains to endourology?
Interesting thing about endourology, right? Like I trained with my endourology fellowship with robotics. And then shortly, it was a few years into my practice, I was like, I just have so many stones to do. I don't really have the capacity to do robotic surgery anymore. And there were so many other specialties like oncology, recon, ERPs now, that were more than happy to do those robotic cases for the complexity of it. And they were sort of almost like catching up, I would say, to the endourologists in terms of the robotic stuff. I actually think endourology is probably poised to actually come out and be looking at robotics to make things more accurate. Like I can see us using this obviously for, we're starting to see this for perk access, but I would also think driving our ureteroscopes. And I also think endo might be the way that actually looks at surgeon comfort and the ergonomics of that and how important longevity to our careers is for patient care. And actually looking at it from a very different perspective, that it's not just about, my hands want to feel good, but how am I going to have a career for 30, 40 years if my hands are all, arthritic and tightened up and I can't really function? So I think that could be where we start to go next. But I think there has been this natural, a lot of the kind of the pure endourologists who are doing more of the stones, the endoscopic cases, have let the robotics kind of fade away from them. But I bet we'll see that resurgence as we figure out different robots.
And then the next question sort of jumps off of that. What, in your view, is the next exciting frontier in endourology?
This is a little bit of a cliche because this might be all of medicine, but I'm very excited to see where AI is going. Endo has so much data that is there that just hasn't been tapped into. And I think AI could be something that allows us to do this, right? I mean, what's the number one thing we're doing? It's stones, right? Like every urologist has to do this, and every urologist is hitting BPH as well. And so is there ways that maybe we can start tailoring that? I think of, when it comes to kidney stones, we're so used to it's just stones. Just everybody has a stone. But there's a lot of nuances between a calcium oxalate, calcium phosphate stone. Even people who make calcium oxalate stones, well, they don't get to it the same way. So can we leverage AI to actually look at these different things and be able to say, let's have some very personalized, customizable patient care and treatment for these people that really have been given kind of the one thing of like, drink more water, eat less oxalates, and everything should be fine. And that's just not trying to move. So I'm kind of excited to see where AI can go. I think there's a lot of obviously excitement in medicine about that, but I think endo could, again, be really poised to take this on, given that traditionally we've been kind of that innovative specialty.
Gotcha. Have you used AI at all in your practice yet?
We're certainly using AI scribes. I am using AI more and more to help sort of facilitate my thoughts as I'm going through things. So like I'll be kind of writing something and then I'll put that into AI and say, here's what I wanted to say, kind of the feeling of that. Can you help me to be better? Because I am not the strongest writer in the world. And so it helps me to actually, take my ideas and put it in. I am very hesitant to want to have it spit out ideas to me, but really kind of want to keep it where it's, maybe that's just because I'm old and I'm not quite ready to dabble into that. But, I would say that, I'm starting to really see the benefits of AI. I have not yet had AI making decisions yet, like the clinical decision making. I should say I have that in my EMR, like there's some background stuff, right? I mean, it does it for us and we don't even necessarily know it's happening, but I haven't directly gone into that.